My task as a Knight Fellow was actually to promote health journalism in Nigeria, and I worked with a local partner, a newspaper in Nigeria. But right now, that task has really been expanded because my work now is primarily to, harness the enormous resources of health journalists across Africa and bring them into an association to help them properly focus their work and to bring these journalists into a pool that they may be able to draw from each other, network with each other, and draw from the enormous resources that that they can share among each other and across the continent. Digital tools have changed everything. They've changed the way we live, the way we do business, the way we do everything. And it is only important. It's so important that people who report health also come into this mix and understand that they can actually use these tools to better their work, to better their journalism, to improve their career. And that's one area that this association is going to heavily focus upon, that we'll be able to train these journalists to make use of available digital tools to tell their story, health stories better, and to bring about the improvement of lives all across Africa. One of the biggest challenges of Africa is that governments and big business are not held accountable. Accountability is a huge part of the challenge that Africa faces today. And journalism is one way to put the feet of those who govern on this continent on fire. And help journalists when they have the tools they need, because they will have resources across Africa. They will have information that hitherto they didn't have, because there will be a network, and this association will make available all kinds of resources, information, expert information, budget information, diseases that are trending across Africa, best practices across the continent and across the globe. All these resources will be put at the disposal of the health journalists, and then they can begin to hold their own governments accountable and to say, this was done over here. Why can't you do it here? Why aren't you doing it here?
My name is Zarina Geloo. I'm from Zambia. I'm a media consultant. I also work as a journalist, and I'm a former Knight Health Fellow. I worked with the Times of Zambia in Lusaka, and I was instrumental in forming a health association. And this association has grown organically from 5 members, and we have at least 30 committed members, paid-up members. And basically what we try to do is to encourage journalists to write on health, to bring the focus back on health, to put it back on the national table as a priority, because in as much as Zambia receives a lot of funding for health, we don't actually see where the money is going to, because we've seen the rise in non-communicable diseases, and we're still grappling with the 3 major diseases: HIV, AIDS, TB, and malaria. So we're trying to get journalists to write a little bit more on these diseases, but also to write a little bit more critically on bringing governments, local authorities to account. Where is the money going to? How is it being spent? And where possible, how we can help to make governments accountable, how we can help civil society to make governments accountable also. So to engender this partnership, we needed to have a core of journalists that were very highly skilled, able to communicate, and knew the subjects. So in a lot of ways, what the forum tries to do, the Health Writers Forum tries to do, is to build the capacities of journalists so that they've got a strong voice, a well-skilled voice, and are able to communicate effectively. I think this kind of effort is necessary now more than ever, as funding for health is drying up. We need to have a core of journalists that will maintain the momentum of getting Africans to choose to live better, to question why they don't have access to medication. And having a Pan-African organization also lends a stronger voice to the local associations. And a stronger voice means that you have a larger platform, you're able to engage with policymakers at the highest level of decision making. And also the amount of resources that the local organizations and in terms of journalists can access by joining a bigger family in terms of digital expertise, getting resources for workshops, building their capacities, and just lending their larger voice to a single entity. Ultimately, what I'd like the Pan-African organization to be is to sit at the table at the highest level of decision making and be able to speak for Africans regarding helping them attain better health.